Good day, friends of Buzzy. This is Dr. Amy Baxter, and today I'm in my little room again, so I am not wearing my mask, but I will hint a little at the end of today's broadcast that I am more and more thinking that if you are protecting yourself, that the trick is actually going to be like a swimmer's nose thing, so that you're not breathing in through your nose at all, because that's really where most of the virus seems to come from. Now, that said, between now and Friday, I'm going to be digging into a lot of different case studies to see if there really are any documented cases of getting COVID through the eyes, and just how frequently it happens that you even get it through the mouth, or for people who can't breathe at all because they're going through a trach, how often they get it through a trach. So before I go around telling everybody that all you need is a nose clip to protect yourself, I'm checking in. But tune in with me on Friday. We'll talk about whether or not all you need is something to make you not breathe through your nose when you're in public. But today is Wednesday, so we're going to have Dr. Keith Cronin with us, and the great part about that is that I actually suffered an injury yesterday morning, and so I'm gonna get a free consult from Dr. Keith about shoulder pain. So I'm hurting here, we're gonna talk to him. Before we do that though, I will answer any of your coronavirus questions. My current gestalt on the issue is that I think this is gonna be a couple year hunkered down thing until we're back to normal. I think we're gonna have fits and starts. I think the whole pump the brake thing is absolutely right. I do agree with the chairman, the chancellor of Purdue University, who pointed out that for people between the ages of 19 and 24, also known as college students, the chances of them getting the disease and becoming sick from it are less than 0.001%. So it doesn't mean there aren't going to be some. There's definitely over 10,000 college students in the country. So one of them could get seriously sick. It'd be about 1 in 100,000 for somebody who might have a permanent disability or a problem from it. But 1 in 100,000 to 1 in a million is probably enough for them to go back to college. So I agree with that. That said, we are very likely to have disruptions in supply chain, to have disruptions in our ability to go out again. We're going to see what happens on Friday from all of the commingling that we had over Memorial Day, because it takes about 5 days to start having symptoms, and in the 2 days before you start having symptoms, that's when 44% of transmission happens. So by Friday, we'll get a little peek at what the exposures caused over the weekends, and then it'll be a week from then that we really get an idea of how much spreading happens because of that. So I still don't think we're going to have a lot of rise in the summer, and some of the reason is because of what they're finding about UV light. Not just how UV light decreases the longevity of the virus, although there's that too, but actually that UV light may be associated with increasing vitamin D levels. Which brings me to today's main topic, vitamins. Okay, so there's been a lot, and I've gotten a lot of emails, pro and con, and what do I think of, and I'm gonna tell you the vitamins that we have been taking or are still taking, and why. So first of all, the Charlie Brown of vitamins. Lucy's always holding it up. It always gets tested, and then it gets kicked away because it didn't end up doing anything in a trial. So here's what I think about vitamin D and coronavirus. Certainly, vitamin D is helpful in reducing the severity of other viral illnesses. It's been proven to do so, and the question is, why, how, and how does it relate to coronavirus? So there's a number of different studies that have looked at vitamin D levels, and some of them find that people who have low vitamin D have more severe coronavirus, some don't. One found that low vitamin D levels was associated with increased mortality, but only in males. So what is the deal with vitamin D? I think that the biggest support for vitamin D is that people who are vitamin D deficient and untreated did die at 1.77 times the rate of people who are not. Now the problem is that if you are known to be vitamin D deficient and you still don't take vitamin D or aren't treated for it, either you're ignoring your doctor and not bothering to supplement with vitamin D, which means that either your life is somewhat chaotic and you may not also exercise as well or eat as well as you should. It may mean that you can't afford vitamin D. I mean, even $8 for a bottle of vitamin D is too much for some people. This is one of the reasons why we ought to increase our support for supplements that are proven to do something, while we ought to actually cover a lot of nutraceuticals and food. But all that aside, so one of the things about vitamin D is that it either could mean that you aren't able to treat something that you should be treating, because there haven't really been good associations with taking extra vitamin D if you're already vitamin D complete, helping with coronavirus. But the other possibility is that certainly one of the unsolved mysteries is that African Americans are getting worse disease. So could it be because they are more likely to be oh, hi, Mindy. They are more likely to be vitamin D deficient. And that's true. So that brings me to the UV light thing, which is a really interesting study that was out of Mexico. Again, this is one of those hot off the presses, not yet peer reviewed. But what they did was they looked at the correlation of areas in Mexico with stronger ultraviolet light and also areas that were higher altitude. So the higher altitude, oh my gosh, Michael Culp, all you guys, my friends. So the higher altitude means that you've got less atmosphere, you're going to have stronger UV, and they were less likely to either get coronavirus or to die from it. And with the correlation overall, it looked like there was about a 17% reduction in the severity of COVID when you had more ultraviolet light. So could that mean that it was killing off the virus? Could it mean that the temperature was higher? But they looked at altitude, so it wasn't just temperature, it was also altitude. I think that that supports the fact that having an adequate amount of vitamin D is protective. So my bottom line is, while we're waiting for any randomized controlled trials, I do think that particularly in males, it makes sense to make sure your vitamin D levels are up to snuff. If you do not have enough vitamin D, then it's likely that it will put you at risk of more severe disease. There are also studies that show that there isn't a difference. So I think that it's not enough to be deficient in vitamin D. It's also that you're deficient in vitamin D and not trying to fix it. So that has a lot of other stuff going on. But certainly, there's nothing that's going to hurt you from taking 100 milligrams of vitamin D, or 100 micrograms, 100 milligrams may be a lot, 100 micrograms of vitamin D a day. That would be 2 of these little golden sunshine tabs. So absolutely nothing wrong with it. And certainly if you're vitamin D deficient, 17% improvement. Getting out in the sun is also good. All right, now the next vitamin is one that is really exciting. And there's 2 studies on this that are super important that have come out within the last 2 weeks. So this is zinc. And it's hard to find zinc by itself. Zinc 10 milligrams is usually what you're going to get in a multivitamin. This is 25. This will do a number on your stomach if you're not taking it with food. And I suppose it could help with acne. I don't know, but this was the only pure zinc that I could find. And so 25 milligrams a day is what I recommend, which would be just 1 pill. Now, here are the 2 interesting studies about zinc. First of all, in Chicago, they added zinc to their regimen of hydroxychloroquine and azithromycin. So zinc has a lot to do with the virucidal activity of your immune system. And one of the things it's also able to do is, it's called a protease. It helps the proteases. It cleaves off one of the places where the virus might get into the cell. The other thing that zinc does, though, that's really relevant is that it seems to be involved in stopping the ability of chains of platelets to form. So let me go back to the Chicago one. So in Chicago, they added zinc, and there was 1.5 times fewer deaths, which is also, well, it was 50, it was half as many deaths, and you were 1.5 times more likely to go home if you were in the group where they added zinc. So it was hydroxychloroquine, azithromycin, and we already know that hydroxychloroquine makes things more dangerous, but when they had zinc in addition, the patients were more likely to go home, they did better, they had less ICU. So the study itself has got a couple problems. The people that were in the hydroxychloroquine azithromycin group only were a little more likely to be more sick. So that paper hasn't been peer reviewed. We're waiting to see what happens. But if nothing else, it did seem that zinc helped a large group of people to be able to go home sooner and not die. So how could that be? Well, in addition to the general antiviral entryway that zinc works, a letter to the editor that came out at the end of last week said that the clotting that we're seeing with coronavirus, so the fact that people are more likely to have strokes, that they're more likely to have COVID toes, which is basically little tiny microemboli, micro clots in the toes. They used to be called chilblains. So the gross little pictures of toes you've been seeing if you're trying to follow any COVID stuff, that is from microemboli. And the thing this weekend said that they strongly think that it's not a problem with the coagulation. It's not a problem with platelets and the red blood cell side of things, that what's really going on is much more that there's something called von Willebrand factor, but it's causing the platelets to make little strings, and then the little strings from damaged, it's called endothelium. It's the part inside the lining of the blood vessels. So it's not the top of it, and it's not that the blood vessels are breaking open and that's where the blood is coming and making a clot. The problem is that in between the layers of the blood vessel, this endothelium, that is spinning off these little chains or strings, they called them, and they noted that the strings get snipped by zinc. So if you have a high enough zinc level, it seems to snip those strings. So they strongly recommended that immediately people go and start doing randomized controlled trials of zinc. I think that there is enough already with the Chicago trial, with the previous support that zinc has heavy antiviral activity, that taking 25 milligrams of zinc a day is part of the regimen I would include. And unlike vitamin D, where you can get up to a certain level and it's a lipid soluble vitamin, so it's going to stick around, zinc is one I would keep taking every day. Now, extremely high levels of zinc can go the other direction. So I probably wouldn't take 50. I would just take 25 if you're an adult. And we are, I'm in contact with one of the authors of the paper to try to understand at what level you top out and the benefit. But I do think that we're going to see zinc being part of what we're looking at. So those are the two vitamins that I have done a deep dive on. And so vitamin D can't hurt, not end all and be all. Zinc may be a serious part of our arsenal to decreasing the severity of the disease when you catch it. All right, and now let's talk about our pain management issues. And so here's the deal. I, yesterday morning, realized I'd been having too many COVID drinking Zoom parties, and I hadn't been exercising enough, so I decided, all right, I can't have drinks 5 to 7 nights a week. I'm gonna work out and start with a fresh slate, and I'm gonna work out in the morning and eat healthy the whole day, and only have like 3 days a week that I'm drinking. I'm probably oversharing. But my point here, when I'm really oversharing, is that I put on my jog bra yesterday morning and I made a whole grid to follow if I was being good. And it took so long that I didn't have time to work out. And so perhaps as some sort of cosmic punishment from not working out, when I went upstairs and took off my jog bra, I'm like right about here, and I'm pulling off, and it hurt like crazy right there and right there. So I was pretty sure I had a rotator cuff injury. And now I'm going to introduce our good friend, Keith Cronin. So Keith, you have just heard what I did, and you've heard why I did, and you probably heard more than you need to about my workout regimen or lack thereof. What did I do to myself, and then what do I need to do to take care of it? Whoa, hold on, let me volume you. All right, now you're volumed.
Well, you forgot to take your vitamin PT, which doesn't ward off COVID, but it does ward off just about everyone else from ever wanting to talk to you, because you're as we say in our business, we're physical terrorists. But there is a time and a place, and here we are. So this is, oddly enough, a very common way that people hurt their shoulder. Now, we seem to think that it's always something sports related, or you flew off your bike, or it was something very traumatic. No, most of what we suffer are just daily things, and to your point, you're taking that bra and you held it in a funky position for a while, but oftentimes when you have that pain where it goes from the front and it goes all the way to the back, it's usually actually not your rotator cuff. It usually could be some bicep tendon pain, or it could be your labrum, where you just kind of shifted that bone over and you can catch something for just a second. Now, the challenge here, though, is it hurts really bad. All right, and anyone out there who says, "Oh, well, that's not a big deal." No, you don't have to get hit by another football player to get hurt really bad. This is all those sensors in your shoulder are designed for a reason to respond to things, and well, you just clipped all of them at the same time. So one of the things that can be done immediately to be able to address this, and why we were talking about it, is if you use your VibraCool, if you get that thing on it within very quickly after, even just a couple of hours, the amount of symptoms and problems that you're going to have over the next several days are likely to be much less. And here is why. Because when you hurt your shoulder, the first thing you're going to do is go, "Ow, I hurt it," and you're going to guard it, right? And then you're going to try to hold it in place. Well, and then you're going to think about it. And you're going to look at it and go, "Ow, this hurts, ow, this hurts." You're going to think about how you did it, why it hurts. You're going to do all these things. Well, that only causes more problems. Remember, pain does not equal tissue damage. Okay, we can have a little bit of tissue damage and a ton of pain, or you could have a ton of tissue damage and a little bit of pain. But when we do something like VibraCool is able to be put directly on the spot, and for everyone out there, Amy showed me yesterday, and she had her cold pack right on the front, right on the back.
There you go.
She had it circled around.
I'm showing them. I put the ice in the middle. I used the elbow one, and I put it up like that, and yeah, and so this was really where it hurt. Like it hurt most right there, so I put it on like there, and then I also stuck another piece of ice back there. And I will say it. I mean, I had to kind of sit up against a couch so that I could hold it in one spot for both of them. But that was my jam. All right, you're back on.
And so what Dr. Baxter did was perfect. This is what in a physical therapy clinic we would recommend something for someone to do. The challenge that we always run is right now it's really hard to get in to see somebody. And also when something happens immediately, if you can do something quickly, you can reduce the severity of symptoms immediately. And so for Dr. Baxter's case, she was able to do that. She put one on the front, cold front and back, and then was able to calm down just those irritated nerves, because right now a bone and a bone went like this and caught some tissue in the middle, and it's just sending so many signals up to the brain and into the neck that say, "Ow, I hurt." You can calm those things down, then you don't get the pain that comes from right here, where you have that levator muscle, which we like to call the martyr muscle. It always wants to hop in. And now all of a sudden you're like, "Oh, I hurt this, and I hurt this, and oh, it hurts back here. This thing must be a disaster." We're having the symptoms.
Okay, so I put this on, and I'm going to ice. I think today I'm just going to ice the front of it. I don't think the back feels like it needs it that much. Do I need to do any exercises, or should I try to not move it at this point and keep it protected?
That's a great question. For day one, even day two, and even into day three, it's just general motion throughout the day. I wouldn't do a whole lot of strengthening, but I would avoid irritating motions, which is probably going to be reaching up and overhead, You got to make sure you sleep with like a pillow underneath the elbow, so you keep it in what we call an open pack position for the shoulder. It just means it's the least contacting between bone and bone. It's the most spacious area for a joint to be. And if you can do that for just a few days, then you can probably end up going right back to all your normal things. Or in the end, if you find it's very debilitating, then you can go look into it a bit more. But far often than not, it's mostly just irritated and it just needs to calm down. And that's what this thing is really good for, is to calm down the pain, calm down your brain, and then you can get back to normal.
Awesome. Well, it's always good to know that you don't have to get surgery and you don't have to go someplace for that. So thank you so much for, and it's also good to know when you're not supposed to push through the pain, because I think that's the thing is a lot of us are like, I'm just going to push through it, and not the right thing. I will say that what I did do immediately was I took some magnesium, knowing that it's an anti-inflammatory, it's a muscle anti-inflammatory, and it can help with pain over about 3 days. So I took 500 magnesium, and I'll keep taking about 250 a day until it gets better. And icing is still good, and great. I'll give myself permission to take it easy. All right. Well, thank you. Hold on. I want to say thank you again. Thank you so much, Dr. Keith.
That shoulder again, vitamin. You have your vitamin PT, and now you've got your vitamin VC right here.
Oh, that's clever. I like that. All right, vitamin VC. Well, it is natural, so that's a good thing. Okay, so on on Friday, we're going to start a new series, which is talking to other people who are on Shark Tank that are doing things particularly relevant to coronavirus. So on Friday, we're going to have Howie Bush, who is the CEO of Dude Robe. And full disclosure, I purchased Dude Robes for all my family. Maybe I'll wear one, and with other things too. But we will have Howard on, and we will talk about what coronavirus has done changing his business and how he's helping people. And if you've got any Shark Tank questions, either one of us will be happy to spill some tea. So join us on Friday for that. And again, by Friday, I will feel comfortable that I have enough research to either recommend, I'm sure I'm going to recommend nasal blocking for if you have to be at the grocery store, if you have to be in a closed space, if you have to be around a lot of people. I'm positive that it helps decrease the absorption of coronavirus, but I'll also have more information on just how much coronavirus is likely coming in through the nose versus other places. Thank you all for watching, and everybody stay safe. And just get in the mindset that we will go back to normal. There will be a time again where we are in mosh pits and where we are watching an outdoor concert shoulder to shoulder with people, where we're gonna play Twister. It's gonna happen. But for right now, get ready, find things to do that are good at home, keep yourself safe, take zinc and vitamin D, and wear your mask. It's gonna be fine. See you Friday.